Let's talk about the anatomy of the neck for a little bit. This is really important to understand, especially if you're having symptoms in your neck, like neck pain, headaches, migraines, dizziness, fatigue. So when we look at the neck from the side, so when you look at this model here, this is the base of the skull. This is where the teeth would be up front, and then you have the curve in the spine. A normal neck curve is right around 42.5 degrees. Now we can measure this through x-rays. We also want to see the discs, so the shock absorbers there that are in between the bones, you can see, those should be nice and open, so it acts as a shock absorber. Of course, if it's bone on bone, that's not good, right? We want to help prevent that, which there are ways that we can do that. Now, when you see the yellow coming out, that's coming from the brain. So the brain goes down through the spinal cord and then out into these peripheral nerves, which you can see in the yellow right there. Some of these at the top of the neck go back up into the head, ears, eyes, nose, and throat. If you're having a misalignment there where it's putting pressure on those nerves, of course, that's not going to feel good. But typically, if it's happening at the top of your neck, this is going to cause things like headaches, migraines, dizziness, fatigue, neck pain, neck tightness. Now, if it's happening lower in the neck, like let's say C5, C6, this is where it can cause things like neck pain, neck tightness, upper back tightness, shoulder problems, numbness, tingling, going down into the fingertips as well. So we always want to analyze every single joint in your spine, especially if you're having some of these symptoms. So you have 7 vertebrae in your neck, you have 12 in your mid back, 5 in your low back. Of course, some people can be a little different, or we have a couple variations there, but that's typical for our patients where they have 7 in their neck. We'll be able to analyze all of those. And in our office, what makes us a little bit different is we like to do motion analysis x-rays. So it's called Pennings analysis, where not only do we take an x-ray where you're looking straight forward so we can see where that curve is at. Remember, we want it around 42.5 degrees. Then we have you bend your head forward. The reason why we do that for the x-ray is we can see how each individual joint is moving on top of each other. That allows us to pinpoint exactly where you're having that pressure on the nerve and where your problem's coming from. Of course, from a consultation and an exam, we can make a very good idea, but this allows us to get an objective finding, which is great because after a series of treatments, we want to remeasure this. And not only are our patients feeling better, they can see that they're actually moving better too. So then we correct them more than just getting them out of pain. We corrected the whole reason why they were having it, getting to the root cause for our patients. Of course, we'll have them look up too, so we can see how those joints are moving backwards as well. It also allows us to see your overall range of motion, which we're able to analyze before and after a series of treatments, so we can see that overall correction for our patients. A lot of our patients are sick and tired of dealing with the pain, and they're looking for a long-term solution, a long-term correction for that. And that comes with finding the root cause first of neck pain. So I hope that helps. If you have any questions, just go and comment below or message our office.